Welcome to It's Your Case, presented by VetCity.com. I am Manuel Pinilla, your radiologist on demand for the week. Today's example is a 10-year-old male golden retriever presenting for chronic progressive hind limb ataxia. Once you have reviewed the radiographs using your systematic approach, then you are ready to watch this video. Now, I will highlight the most important findings on these spinal radiographs, and we are going to start taking a closer look at the lumbar and lumbosacral areas. Here you will have noticed ventral to L3, L4, a smooth, well-defined area of new bone formation that is bridging the disc space, and similar to that at L6, L7. And these are two examples of ventral spondylosis. This on its own is not a reason for concern, and in fact is pretty much expected in a dog of this breed and age. If you continue further caudally, you will notice a very similar lesion here, ventral to the lumbosacral junction. But other than the ventral spondylosis, I could not find any signs of pathology, and definitely nothing that would explain the very severe clinical signs this dog has. So we're going to move on to the thoracolumbar junction, and here we can still see that ventral spondylosis that we saw at L3, L4, but everything else looks normal. And remember, spines are anatomically very complex, and you have to be very thorough. You need to look at everything, for example, the disc spaces, one at a time, checking their opacity and their width, look at the intervertebral foramina, look at the articular facets and synovial joints, spinous processes, and you need to do so for every single vertebra. So this is time consuming and you need to be very thorough. And if you have done so, by the time you go to the thoracic spine, you may have noticed a lesion here. If you have not seen anything, maybe pause the video and take a closer look. Now, if you look, for example, these two spinous processes are fairly close together, similar distance to this one. However, if you go caudally, you will see that the space between this spinous process and this spinous process is much, much bigger. If we look closer into this, you will notice that the cause for the increase in the space is because actually one of the spinous processes is missing. Let's take a closer look at what we would expect to see in the spinal thoracic area in this region there. And if you look carefully, you will notice this very sharp line, which is the caudal articular facet, and this follows into the spinous process here. And if you look at the next one, you will see exactly the same features, and in fact parallel to it you will notice there is a second line, and these are the synovial joints of the thoracic spine. If we follow from this point cranially, you will notice a very faint radiopaque line, which is the lamina of the vertebra, and that is what forms the roof of the vertebral canal. Now, if you compare, for example, this space here to this space here, you will see that all of those anatomical structures are actually absent in this region. So the lysis of the spinous processes is extending across the lamina and across the synovial joint in this space, and therefore this is suggestive that the lesion is growing into the vertebral canal, which would very well explain the clinical signs the dog has. Now, what could be happening here? What could cause this degree of lysis? Well, it has to be something very, very aggressive, because you can see the bone is just absent and there is not even an attempt for the bone to remodel or any periosteal reaction. So this has to be something that is growing really fast and right across the bone. I cannot think of anything else other than neoplasia that could do this. However, I think there are many different types of tumors that could do it. My first idea would be probably some type of sarcoma, such as an osteosarcoma or histiocytic sarcoma, but a round cell tumor, for example, a plasma cell, could do similar features, and also even metastatic disease. So what could we do for further investigations? There are many ways to approach a case like this, I suppose. First, I would suggest you try to rule out metastatic disease, so maybe thoracic imaging. You could do cross-sectional imaging. I think CT would allow you to see this in very good detail, check the degree of invasion of the canal, and at the same time rule out metastasis. If you need a final diagnosis, however, chances are you will need a biopsy, and maybe the easiest way to reach this area would be with ultrasound guidance using a dorsal approach, although there is quite a bit of subcutaneous fat, which may make the ultrasound a bit of a challenge. So be sure you review the full report associated with this case. Thanks for listening, and remember, it is your case, so please post your questions on the social media.